Welcome to the RiverView. My name is Irene Whibley.
And my name is Mary.
My name is Joy.
I'm Marlene. We welcome Dr. Berge, Doctor of Audiology, as our guest today. Welcome, Dr. Brenda.
Thank you. Thank you.
So the one thing that was really on our minds is not one of us wears a hearing aid, but if we're not having trouble, should we consult your clinic, you know, just as a precaution, like to get familiar with it or to have a test? Or
That's a great question. I wouldn't say my clinic in particular,
No,
but absolutely, I would suggest
to find out if there's something wrong with it.
Absolutely, but I wasn't going to say no.
Well, we could have something wrong.
You know what? I think it's a great idea because, right, often people don't think precautionary. It's a good idea, even if it's just to get a baseline. It is something that's really good to do, especially as we get a little bit older, and specifically because hearing loss, the person that actually has the hearing loss is actually the last one to know. It's the family around them and friends that you guys are playing cards with. They're the ones suspicious that maybe there's a problem. So yes, I think it's an excellent idea.
now, Dr. Brenda, do you have to be referred to a hearing clinic or like by your family doctor?
Good question. Not always. I mean, I can only speak on my office. A physician referral isn't required. However, we certainly get lots of physician referrals because I think it's a great idea to always keep your family doctor involved because truly, this is part of your overall health care.
Now, Mary worked in the schools doing dental with the school children, dental work. And so she had an interesting question.
No, I was wondering, could molars have any effect on the ears if you had a bad toothache or something?
You know what? That's actually a possibility, okay? Because where the jaw comes into alignment with the rest of the skull, if you feel right back here where your jaw opens and your molars are right there at the back, absolutely. If the molars are infected or you've just had them removed, that inflammation can actually cause an ear pain. It's technically called a radiating pain. So while you may see the physician for ear pain, the cause is actually elsewhere in the body. And the ear and the jaw are very intimately related. So that's a very common thing.
Good question, Mary. So now maybe you could show us this ear, the model of the ear. My goodness.
Great. I'd love to.
No wonder I weigh a lot if that's the way my size of my ear.
Well, luckily, no, I'm just going to use this as a model show. So I'll do it this way, all right? So we all... Look at that. There we go. So obviously we think of the biggest part of the ear, that which we can see, all right? And then, I know you got, there you go, you ladies, this is the ear canal, all right? That's the part that we all know can get built up with wax.
Oh, yes.
Oh, yes. And isn't that what we always hope for with hearing loss? We hope that it's wax, clean it out, and return your hearing to normal. It's a little questionable whether that's going to happen when you're past your 70s, and likely we expect some level of hearing loss sometime beginning after 65 or 70 years of age.
What can you do to remove that wax other than flushing your ears? Some people say put drops of this in. I've heard olive oil and I've heard peroxide.
I said peroxide today. That's what the doctor suggested, was peroxide.
Yeah.
Put just dribbles of peroxide, then hold your head that way, and it bubbles, and it really bubbles, but it doesn't hurt.
No,
and
it does
then
not
you just
hurt.
pour it out, and this is what I was told.
Well, you know, those comments are common, and some physicians will recommend peroxide, some will recommend oil, but the reality is if we get a large accumulation of wax in the canal, it has a weight to it or a mass. And so just because you put a fluid in, and by the way, oil is preferable, to be honest, because it's a softening agent, but because that mass is sitting in there, just because you put a liquid in doesn't mean that it's going to develop inertia and start rolling its way out of the ear. The likelihood is someone needs to harvest it. Someone needs to get it out. As to how we do that, it depends on who you see. Certainly family physicians, and I'm sure many of you ladies have had your ears syringed or cleaned. That's one way of doing it. In our office, or most of my colleagues, the audiologists and the ear, nose, throat surgeons, we have more tools to a little bit more gently remove the wax than the equipment that's used by the family physicians, because it's just, we're set up specifically and only to do ears. So, excellent.
And I guess they follow that old rule, you really shouldn't put anything in that ear.
Anything smaller than your elbow in your ear. Exactly, that's exactly.
Q-tips. I punctured my eardrum.
Yeah, Q-tips are really a no-no.
Absolutely,
Yes.
absolutely. And that's the thing, you know, let me just explain. When people think that they're using a Q-tip to clean the ear, what ends up happening is that Q-tip ends up being like a snowplow. And it gets it deeper and deeper and deeper and deeper. And yes, if you have the unfortunate mishappenstance of rupturing your eardrum, well then certainly that's not a pleasant situation. It's very painful. It takes a while usually to heal.
You know what happened to me one time? I was living in the apartment just down here on Woodlawn, and I was just laying on my couch one night, and I could hear this sort of a buzzing noise in my ear, like it sounded, you know, when there's steam coming out of somewhere. It just sounded like that, and I thought, gee, there must be something wrong in this apartment that you know. So down I go to the manager, and I says, Russell, there's something wrong in my apartment. I said, I got this buzzing noise. Is it coming from vents or something? He said, no. He said, no. He didn't say no. He went and got the girl from the office, and she came up with him. And he said, oh, I can't hear anything, Mary, he said. And he went in all the rooms and can't hear a thing. So then I thought, well, I better go see Dr. Ziegler. I went to see Dr. Ziegler. He says, Mary, you punctured an eardrum.
Oh, my goodness.
Wow.
You've got hearing loss, he said. That's what he said.
Right.
How did you puncture that? How did you do that?
Well,
With the...
cleaning them.
So does that heal itself then?
Oftentimes it will. Oftentimes, and if you're lucky, it will.
But I don't have that buzzing anymore.
Well, did Dr. Ziegler mention what that buzzing is called? Because that
Hearing loss, he told me.
the buzzing is actually called tinnitus. But the reason that you would have the buzzing is because of hearing loss. So that
Because
sound,
of what?
because of hearing loss.
Oh.
The only reason that you have tinnitus is because you have a hearing loss. There are very few exceptions to that rule. So the statistics show that 99% of patients who have tinnitus have hearing loss. So it is a secondary symptom to your loss.
But I hear good. That doesn't bother me.
And
I think I'll be
too
making
much sometimes.
And a hearing test would tell us where you got the opportunity to prove to me that your hearing was absolutely fine and normal. And then we'd have that conversation. But I expect just a little bit. Just a little bit. The problem with hearing losses is people get very almost defensive. They go, no, I don't have hearing loss. And they think of deafness. It seems to be either black or white. But if you think about it the way you think of eyes, I mean, I have vision loss, but I can certainly do without my glasses. I can read without my glasses. I can drive without my glasses. But the optometrist says, my eyes are not 20/20 anymore. And so there are times that you will be mildly affected.
Well, you sound very clear, so are we all right?
I think I better give this hearing test.
Every word I hear and understand.
Well,
So-
but the issue is with my profession,
yes.
I speak loudly and I overemphasize my consonants because I know most elderly patients have some mild level of hearing loss. So what's happening is I'm compensating for any possible loss. But this is where we should not expect the public and the rest of the world to do that because they don't know that element.
Yes.
I do just because I'm in my office 8 hours a day.
Just like you're a teacher, and when Marlene speaks, we all hear her and understand every word she says. Or some of the others, when we speak at the table, What'd you say?
Now-
it's not that we didn't hear, but it's
Oh,
just that
My
they
quest-
mumbled.
Oh dear, there we go. And my question to you is going to be, well, if they said something and you didn't hear
Yeah.
it, what do you think the problem was?
Oh,
They
yeah.
mumbled. It's not my
Oh,
fault.
dear.
We're all talking at
She's so
once.
busy talking.
But you know what, it allows us the opportunity to speak exactly on that point. The sensation of the listener, the perception of the listener, that other people just don't seem like they're speaking clearly enough is classic for very early onset hearing loss due to age. It's called presbycusis. And so the belief by the listener is honey or sweetheart or grandchildren, if you just speak a little bit clearer, I'd hear you better. But remember what that does is it projects the problem to their voice instead of the three fingers pointing back at your ears.
Well, what about the people with these cell phones and these music things, you know?
Question is down the
All
road,
the
may
noise.
they present with hearing loss?
Yeah.
Certainly possible. Certainly possible. They have to do a lot of really loud sounds in their ears, and usually after their 20s to start causing noise-induced hearing loss.
Anything else you'd like to say about this model we have here? I
Certainly.
know there's so much to
There is so much to the ear and hearing. In fact, one of the first things that I should mention is the ear, or the otic system, also includes the balance portion.
Yes.
Okay, so of our ear, I'll show you ladies first, there's the outer ear that we recognize,
The canal.
there's the canal, this is the eardrum. That's what, for example, Dr. Kodalik or the attending physicians here would be looking for. That's the part that we can see. So if you have an ear infection, sometimes we can see that there's fluid behind the drum. Sometimes the eardrum itself gets very red and it tells us it's angry and it needs treatment. Other times we can't see if there's fluid behind. Behind that are three bones of the ear. And then this part right here, the snail, this is the hearing portion of the ear. And related to it and contained within a bone, which houses two different salt fluids, this is called your semicircular canals. And your ears, each one, is responsible for 2/3 of your balance. So if we take away vision and we take away sensation, we know because of our ears where our head is in space because of these semicircular canals. This is responsible for left-right movement. This one's responsible for up-down movement, and this one's responsible for angular movement. And so it's really your ears that do 2/3 of the work to keep your balance and know that you're safe.
My goodness.
Now, when they clean the ear out,
Yes.
where does that tube go? Right through the canal?
Where does the tube go? Certainly, we would use the equipment, and we would use possibly suction or curettes, which is a small medical loop, and we would go into this area and
Takes the wax.
remove it out. Right. Oftentimes, suction is really the safest way to go in and pull it out. Or we also have a water procedure that's a little bit more gentle than this syringe, but that's how we would do it. Now, if you had a hole in the eardrum, like you mentioned, it means we're not allowed to use water because it can cause an infection behind the ear, because that will get into this part here called the eustachian tube, and then it'll get infected into actually first the middle ear cavity, right? It gets in behind this area here. This part of the ear produces mucus, and then it just festers. So we have to be careful to know the status of your ear before we clean it.
Do you think anything wrong with your has anything to do with your taste buds?
Oh, I can't comment on that. That
No.
would be outside my scope of practice. That would be the ear, nose, throat person.
Okay.
Yes.
How often should you get your ears checked?
The recommendation by the academy is just once a year. Kind of like you get your eyes checked once a year.
Like your teeth?
Your dentist, well, you see probably more than once a year.
Twice.
Yeah, so it's a good idea.
Well, thank you for watching the review, and thank you to Dr. Berge for joining us today. It's been very interesting.
Well,
very
ladies.
interesting, and we've learned a lot.
Well, thank you.
Yes,
Thank you for the
yes.
invitation.
We
I'm
have a
quite
little
honored.
gift for you,
Thank you so much.
and we'll enjoy the
Thanks.
strawberry chocolates here.
Yes, yes.
Thank you for that.
Thank you.